I'm here with Epidemiologist Bonny Specker, who is going to give us a COVID-19 update about what has been happening with COVID in our area, across the state, in the nation, and in the world. And also, she's going to talk to us a little bit today about the Omicron variants that you may be hearing about in the media and in the news. So what do you have for us today, Bonny?
Well, thanks, Chelsea. A couple of the other things I wanted to do was the South Dakota death data that's updated. They try to do that every month, and I'll do that as well. Some of the mobility data, I updated that yesterday. People probably have heard that the World Health Organization earlier this week designated the Omicron as a variant of concern. And the reason for this is that they're worried because there's a really large number of mutations in that spike protein that's on the outside of the virus. And they're worried that that might make it more transmissible and that it also might avoid the immunity that you get from the vaccine or a previous infection. But there are an awful lot of uncertainties about it. They don't have an idea right now of how transmissible it is, how contagious, and whether any of the increases that we might see in infections are related to immune escape. Like, are you seeing more infections among people who were vaccinated? And do the vaccines protect not just against infection, but also clinical disease, like the severity and in terms of the disease and also death? Like, we know now that the vaccines protect against the Delta variant in terms of hospitalizations and deaths. It's not 100% protection, but there's a definite protection if you're vaccinated with that Delta variant. And they also don't know whether this variant presents with anything different. You know, do you have the loss of smell, the loss of taste? What are the symptoms if you're infected with it? Because it is such a very different virus now with all these mutations than what we've had in the past. But a lot of these questions, even though we don't know them now and there's a lot of uncertainties, it should be pretty quick, you know, to find out some of these answers. So people should be paying attention over the next couple of weeks. A lot of answers should be found. I think it's important to realize that as long as there's cases of COVID out there, there's going to be these variants, and these variants are going to mutate. And we really need to work on vaccinating a large percent of the world population in order to minimize the number of these particular variants. Fewer cases mean fewer viral mutations. If you think about it, I guess one way I think about it, when I was in graduate school, you know, we talked a lot about cancer epidemiology, and the more cells that turn over, the more likely you're going to get a mutation in a cell that then leads to cancer. It's sort of the same thing when you're talking about viruses. The more times they replicate, the more chances you're going to get mutations in it. And you don't want mutations that can avoid the vaccines or cause more severe disease. As far as the CDC, and I do have links on all of these where people can look at these issues in more depth, but the CDC is continuously monitoring variants. They don't sequence every positive test. That's just way too expensive. But they do samples, and they did identify an Omicron variant yesterday out in California. It was someone that had been to South Africa recently. So it is in the United States. They emphasize that everyone knows what it takes to prevent the spread of COVID, and it's the exact same thing with this variant. You wear a mask in public indoor settings in areas of substantial or high community spread. South Dakota and the surrounding states are all in very high community spread. So people should be wearing masks in indoor settings. You should be washing your hands frequently, and physically distancing from others. And remember to be concerned, especially now in this part of the country, about areas with poor ventilation. You want to make sure you have that good ventilation. They also are recommending that everyone 5 years and older should protect themselves by getting fully vaccinated, and that the booster, people should be getting the booster. If you had Pfizer or Moderna originally, you need to wait 6 months after completing that primary series before you get your booster. And the booster is being recommended for everyone 18 years of age and older. The Johnson & Johnson was that one-time shot. And if you had that 2 months or more ago, you should be getting a booster for that. And you can mix and match the type of booster. Just because you got Johnson & Johnson initially doesn't mean that's what you need now or have to have now. As far as the South Dakota data, this is the deaths, and it's by cause and year. This is 2010 to 2020. And you can see that in 2020, COVID was the third leading cause of death behind heart disease and cancer. When this is a big mash of a whole bunch of different types of causes other than those listed here. This hasn't changed because this data was finalized early in 2021. I just want to show what they're doing for 2021. They're looking at the number of deaths from January to September in each of these years. So, this data right here back in 2018, this was the number of deaths that they had seen between January and September. That way you can compare what's happening in 2021 with historical data, but you have to adjust for the number of months that you're including it, obviously. You can see here that in 2021, we've had more deaths between January and September than we did back in 2020 from COVID. It's now moving up. And if you look at historical data, this is all the way back to 1960. And this solid white line is the average. This dotted line is the highest number death rates reported during this 70-year period, 60-year period. And here, this blue line is what happened in 2020. And you can see that these are the highest number of death rates that have been seen in the last 60 years in South Dakota. And in 2021, during the month of September, that's the highest death rate ever reported. So we're still having, very high number of deaths in the state. I think people have just kind of ignored it or pushed, they don't want to deal with it anymore. So it's like not an issue, but people are dying, and more people died in the month of September than any other September for the last 60 years. If you look at mobility data, and I think this shows how people are just tired of this whole pandemic. Back in 2020, a high percent, this white line, are the percent of time people were spending in their homes against the baseline, which was back here in early 2020. And you can see that they spent more time in their homes. This yellow line is the average time outside of their residence, and you can see that it's below average. And that was true for the beginning of this year. And then now you can see that the time that's spent in non-residential areas is pretty much back to baseline. This orangish brown line is retail and recreation. People are actually, these are weekends, these little spikes where they're spending out shopping or going to parks or whatever. This big drop here is Thanksgiving. Fewer people are working. And more people are at home. You can see the little peak here. So you can see that we're pretty much back to normal mobility, despite the fact that we are still in significant spread and have still a problem. People are beyond that. And I think you can see this with the Brookings data. We've been in a high level of spread since early August. And the last 2 weeks, we've had, 70 cases per week. If you look at the age distribution for this past week, 19% of these cases are less than 20 years of age. More than half of them are 20 to 39, and they're probably the ones that are out the most. 14% are that 40 to 59, and 11% are 60 years and older. Also, this 20 to 39 year age group is the age group that's got the lowest rate of vaccination. So it's important for these younger people to realize that in order to slow down this pandemic and get us to a lower level of community spread, it's really important that they get vaccinated to help the community. If you look at test positivity, we're extremely high. Brookings County is at over 10%. We want this below 5, way down here. And this spread is based on percent test positivity. So we are going up. We're up here to almost where our highest. If you look at hospitalizations and deaths, we didn't have any hospitalizations last week, which is a good sign, but that is delayed couple weeks from when you start seeing increases that we've had. We did have a death. There was 1 death last week compared to 1 the week before. Now, if you look at the state, you can see they're not doing well at all either. We are still quite high in terms of community spread. And this doesn't change. I think I've mentioned that before. It's roughly equal among all the age groups. There was a slight decrease, but we're running about that 3,000 level of new cases per week. And we are increasing in the number of active cases that are out there. We also have a very high test positivity, which is not good. This is indicating that there's a lot of positives out there that we don't know about, that are spreading this virus. South Dakota is one of the highest test positivities in the United States, and we actually test fewer people than most other states test as well. So it's important, if people want to help the state, what they should be doing is if they have any symptoms, going out and getting tested. It's free. If they have a negative test, then they're going to cause this number to go down, which will be good. And it will also help stop the spread of this if they identify these cases and get them quarantined. If you look at the hospitalization data, we have a large number of people in the ICU, 68 of them as of yesterday. There were 249 patients hospitalized. There are quite a few of those are in Sioux Falls, and Brookings has 2 or 3, I think, hospitalized right now. The thing that I've mentioned before that is interesting to look at is if you look at the number of admissions back here and how far this line of hospitalizations and ICUs are currently hospitalized, there's not a lot of difference between the new admissions and here. But here, we have a lot of people in the ICU and a lot of people hospitalized relative to the number of cases. And I think this is reflecting a more severe illness among people with the Delta variant. And it'll be interesting to see if this plays out in the future when they go back and analyze these data in more depth. But I do think that the Delta variant may be causing a more severe illness. If you look at the hospital admissions, we've got 4% of these people that were hospitalized in the last week were less than 20. 15% were 20 to 39. 22% were in that 40 to 59, and 59% were 60 years and older. So it is mostly the older people that are being severely affected, but there's still a substantial number. I mean, we're talking more than 15% of 129. You know, more than 15 of the people that were hospitalized this past week are in their 20s and 30s. So it is affecting those younger people. If you look at the deaths, we had 29 deaths last week in the state. This has gone up. You know, if you compare it to the average number of deaths for an entire flu season is 34, you know, for an entire year. We were close to that in COVID deaths just in the last week. 6 of these were between in their 40s and 50s, and the rest were 60 years and older. If you look at the US, the numbers, it looks like it was down last week, but if you look at it by day, it's coming back up. So I think it's hard getting this Delta variant to come down. You know, it's staying persistently high. And again, most of these are the unvaccinated people, both in cases and in deaths. This is also coming back up if you look at the daily data. But based on the data that I look at, you know, there was quite a significant decline last week, but I think that you'll see this going up next week. If you look at the world data, about 4 million cases last week, new cases. Europe, Germany, a lot of Europe is getting hit pretty hard right now by the Delta variant and possibly Omicron. We'll see what comes out in the next week, what percent of the cases. If you look at deaths, we're running about 49,000 deaths per week, 7,000 deaths a day globally from this virus. So it's around, and I encourage people, take care of yourself. I don't know if the people who aren't vaccinated, if anything can be said to them to get them vaccinated, other than, think of others and think of your community when deciding whether or not you're going to be vaccinated, because this is an important public health and community health issue. So that's all for today.
Well, thank you so much for the update, Bonnie. For the people that are watching, I just wanted to let you know we have moved the videos to monthly, so we will be doing monthly updates from now on. So I look forward to putting out another video in a month and providing updates back then. So thank you, Bonnie.
You're welcome. Take care.